We're going to take a look at a case of COVID pneumonia on both X-ray and CT. Here's a frontal chest X-ray. What we're seeing in both lungs are these patchy opacities. There are some in the right lung base. Compare that to relatively normal aerated lung up here. This patient went on to get a CT. We have axial images in our lung windows. You can see there are these multifocal ground glass opacities in both lungs. Whenever we see findings in the lungs, we want to describe their distribution. Here, they're obviously bilateral, involving all 5 lobes. And I would say they're also peripheral predominant. For example, right here, we see most of the opacities are towards the periphery of the lungs along the pleural surface. There's also a bronchovascular predominance, where you see these opacities surrounding the bronchi as they are here. Here's another good look of some that are surrounding the bronchi. So this is a fairly common pattern with COVID pneumonia. Imaging findings in COVID are variable depending on when you image the patient. For most patients, imaging findings are worst at about 10 days following the onset of symptoms. For patients who do recover, after several weeks, you'll notice it evolve into an organizing pneumonia pattern. And then after that, the opacities will start to clear up. And in patients who do recover, the lungs should return to a fairly normal appearance. You might have some areas of scarring, but most of what you see here will resolve. Important to note that this imaging appearance, although it is pretty classic for COVID, can also be caused by other organisms and viruses. For example, influenza or even bacterial pneumonia could cause this appearance. So you want to correlate with what the patient's presenting with and check out their COVID test as well.